Hi everyone, my name is Ingrid,
And my name is Avery.
and today we are going to talk about sexual health. Before we start, we just want to give our usual disclaimer that we are a student-run organization, therefore we are not health professionals, we are not teachers, and we are not a crisis line. So we'll begin by quickly defining the term STI, which will be followed by us identifying some of the most common STIs. Then we'll quickly go into contraceptives and negotiating safer sex before providing a number of sexual health resources. So to begin, STIs stand for sexually transmitted infections, which we'll break down word by word in just a second. For this video, we will be talking about STIs by means of human sexual behavior, so vaginal, oral, or anal sex. So sexually, STIs are transmitted through sexual activity, like I just said. In terms of transmission involves an infected individual giving the STI to a healthy individual through different modes of transmission, such as bodily fluids, skin sores, warts or rashes, pubic hair, and other used personal items. And finally, infections describe the state of being infected with a disease causing organism, which aims to cause harm to our body. So that could be viruses or bacteria.
So, the first STI that we're going to talk about is HIV. HIV stands for Human Immunodeficiency Virus. HIV is a virus that is transmitted via bodily fluids, just as Ingrid mentioned, from an infected individual. The four major bodily fluids that can transmit HIV are blood, semen, vaginal fluid, and breast milk. It's important to know that unless saliva is contaminated with blood, saliva cannot transmit HIV, and this makes kissing actually a pretty low risk activity for transmitting HIV. HIV causes the immune system to become weak so that the body cannot fight off infections such as a common cold, and AIDS is the disease of the immune system that is caused by HIV. AIDS stands for Acquired Immune Deficiency Syndrome, and a person infected with AIDS may not have sorry, a person infected with HIV may not yet have AIDS, but a person who has AIDS is still infected with HIV. As AIDS progresses, immune cells become infected and killed, weakening the immune system and making the person much more likely to get infections, especially opportunistic infections. Opportunistic infections may be caused by bacteria, viruses, and fungi and parasites that are normally controlled by the immune system, aka, they normally don't infect healthy people. I just want to clarify, not necessarily other sexually transmitted infections, just any infection in general. AIDS-related stigma and discrimination refers to prejudice, negative attitudes, abuse, and maltreatment directed at people with HIV and AIDS. The consequences of stigma and discrimination are wide-ranging, being shunned by family, peers, and the wider community, poor treatment in healthcare and education settings, an erosion of rights, psychological damage, and a negative effect on the success of testing and treatment. Although HIV and AIDS are a very serious, life threatening set of diseases, stigma has very detrimental effects and it's very important to combat it.
So moving on, we'll be talking about HPV. Basically, HPV infects cells inside and outside of the body, such as on the skin, tongue, throat, tonsils, vaginas, penis, etc. There are many different types of HPV that cause different diseases in the human body. And examples of HPV include skin warts, which are very harmless and easy to treat, and genital warts, which pose a little bit more threat because undetected, genital warts could lead to precancerous lesions, which basically is something that can progress one to cervical cancer. HPV is transmitted by skin to skin, mouth, or genital contact with the penis, scrotum, vagina, vulva, or anus of an infected person. The virus can still be transmitted even if the warts go away or if someone wears a condom, as condoms do not cover all skin. A pap test, which is the graphic you see in the middle here, can be used to detect genital warts. And while there is no cure for HPV, they can be successfully treated by some cream and chemical remedies. And some ways to reduce the risk of contracting HPV include using condoms, regular STI screening and pap testing, abstaining from sexual activity, limiting one's sexual partners, or finally only having sex exclusively with a long-term partner, which is a term called monogamy.
Hepatitis means inflammation of the liver. So, this includes scarring of the liver, liver failure, liver disease such as cirrhosis, and liver cancer. Hepatitis is transmitted when the blood of an infected person enters the body of another person, and it can also be transmitted by unprotected sex. A blood test is required to diagnose hepatitis, and drugs from the doctor are needed to treat it. There are several ways to prevent hepatitis. Some of them include washing hands after using the bathroom, changing diapers, and preparing and eating food. Never using shared needles. Healthcare workers should follow routine protection barriers and use clean needles. Taking vaccines, there's vaccines against hepatitis A and B, and using protection during sexual intercourse.
So, genital herpes are caused by two different virus types. So, there's HSV1, which is responsible for most cold sores. So, that's what you see on the lips, around the eyes, etc. While HSV2 is responsible for most genital herpes. Genital HSV2 is more likely to be transmitted from a male partner to a female partner, usually, and individuals with HSV2 infections tend to not have sores or have sores so little that they are mistaken for insect bites or some other kind of skin condition. Someone's first episode of genital herpes can come in several outbreaks within a year, but don't worry, as these do decrease in frequency over time and over that year. Genital herpes can be transmitted via vaginal, anal, or oral sex, even if the infected partner does not have visible sores and or they do not know that they are infected. There is no treatment to cure herpes. However, antiviral medications can shorten and prevent outbreaks during the period of time that I mentioned before. Prevention against herpes includes protected sex, regular testing for STIs, abstinence, or monogamy, as we've previously defined.
So, chlamydia is one of the most common STIs worldwide. It is caused by Chlamydia trachomatis bacteria, and it affects the cervix, rectum, urethra, or even sometimes the throat. Chlamydia can be transmitted during vaginal, anal, or oral sex, like many of the other STIs, and can also actually be passed from mother to her baby during vaginal childbirth. Most people don't have symptoms, but if they do not appear until 2 days to 2 weeks after contracting the infection. Symptoms for women include burning while urinating, vaginal discharge, or a change in normal discharge, bleeding between menstrual cycles, increase in pain during menstruation or during intercourse, and abdominal or lower back pain. Symptoms in men include itching of the penis, pain while urinating, discharge from the penis, and there may also be pain and swelling of the testicles. It's important to note that chlamydia conjunctivitis or an eye infection is the most common cause of blindness worldwide. So, as you guys maybe can see with the person with the cane, that's why that's there. Um, Eye infection is spread by fingers, shared towels or cloths, coughing, and sneezing. Chlamydia can be effectively cured with antibiotics once it is detected since it's a bacterial infection. And since chlamydia spreads sexually, the use of protection when engaging in sexual activity and regular testing for STIs is key for prevention.
Next up, we have gonorrhea. So, gonorrhea is a bacterial infection that, if left untreated, could spread throughout the body, joints, and heart valves, causing health conditions such as any type of inflammatory disease. Gonorrhea can present with no visible symptoms or symptoms very similar to a bladder or urinary tract infection, which can make it very hard to detect. It is transmitted through unprotected sex with an infected person, but like chlamydia, it can also be transmitted from an infected mother to their baby. Thankfully, gonorrhea can be effectively cured with antibiotics once it is detected, and prevention against gonorrhea is pretty standard to a lot of what we've seen so far, so protected sex, regular STI testing, monogamy, and or abstinence.
Okay, so syphilis is another bacterial infection. It is generally a very rare STI, but it is still very serious, and in rare cases, it can even cause death. Syphilis presents with a wide range of symptoms that can seem like many other illnesses, therefore, it is very difficult to diagnose. Syphilis is transmitted through sexual contact, and it can also, again, be transmitted from the mother to the fetus during pregnancy and birth. Syphilis can be effectively cured with antibiotics once it is detected. There's no vaccine for syphilis, and unfortunately, barrier methods such as condoms do not completely eliminate the risk for syphilis, just like they don't for HPV. This means that the only way to be guaranteed not to get syphilis is by abstaining from sexual activity altogether, only having sex with a long term, mutually monogamous, uninfected partner. Um, yeah, that's it. Sorry.
It's okay. Next up, we have crabs or pubic lice. So basically, crabs are caused by these crab-like insects nesting in pubic hair, and their purpose is to feed off of human blood once they puncture the skin. They could also live in other areas of our body with hair, including our eyelashes. The insects can crawl from one person to another during intimate contact, and they can also be transmitted through shared bedding, towels, or clothing, as they can live on these materials for 1 to 2 days. There's a misconception that crabs are related to poor hygiene, which is untrue, as anybody could get them. And in context with STIs, a major risk group would just be that sexually active people are likely to get pubic lice. Symptoms of crabs include intense itching or bluish gray patches of skin, and this is caused by the insect's bites. And crabs, unfortunately, will not go away if they are not treated. And so, to do so, one would need to undergo methods such as taking a fine tooth comb and on prescription shampoo to comb through the hairs and to get the insects out.
So, scabies is a contagious skin infection kind of similar to crabs, which are caused by parasitic mites that dig holes under the surface of the skin and lay eggs. Usually, they are not directly visible. It takes about 4 to 6 weeks to become symptomatic from an initial infection, but if you get infected again, so reinfection symptoms can manifest in as little as 24 hours. Symptoms include intense itchiness, a reddish rash on fingers, wrists, armpits, waist, nipples, or the penis, and scabies can progress into a more severe form of the infection associated with immunosuppression called crusted scabies. Scabies spread through close skin to skin contact with someone who is infected. Scabies can also live on for 3 days on clothing, towels, and bedding. Treatment of scabies includes a special lotion prescribed by a doctor which is applied to the whole body. Possibly contaminated items should be washed and bagged. To prevent scabies, avoid sharing unwashed towels and clothing and wear underwear while trying things on in the change room.
So, finally, our last STI we will cover in depth will be trichomoniasis or trick, which is caused by an infection of microscopic parasites at the vagina, urethra, bladder, cervix, or under the foreskin of uncircumcised penises. Many do not show symptoms of trick, and symptoms in women that do show tend to include an itching or burning sensation, discomfort during sex or urination, and abnormal vaginal smell. The symptoms themselves could come and go, remaining dormant for anywhere between months to years, and in severe cases, the trick parasite could lead to pelvic inflammatory disease. Thankfully, trick can be treated with prescribed medication, and its prevention methods are once again typical of many of the other STIs we covered. So, protected sex, regular STI testing, abstinence, and monogamy. So, once again, restricting the amount of sexual partners that you engage in sex with.
So, as we mentioned several times, the only way to prevent STIs are either to abstain from sex, only have sex with a long term, mutually monogamous, meaning both of you only have sex with each other, partner, or to use a barrier method for protection. Of course, not everyone is going to want to abstain from sex or only have sex with a monogamous single partner. So, protection methods are a great way to prevent STIs. We do want to be extremely clear that barrier methods are the only type of contraception that can prevent STIs. So things like the pill or maybe an IUD, things that can prevent pregnancy, cannot prevent STIs. We just want to be super clear about that. The two types of barrier methods that are available are male condoms and female condoms. A male condom is a barrier of uh, fluid transmission, so the skin to skin fluid transmission that often spreads STIs. It is made of latex or polyurethane, and it is put on the penis before contact with the mouth, anus, or vagina. The female condom is made of polyurethane, which is a thin plastic, and it is placed into a woman's vagina in advance of sex, and the end has a flexible ring to keep it in the vagina.
So, while it can definitely be difficult, uncomfortable, and a scary topic to bring up when negotiating safe sex, talking and negotiating safe sex shows that both partners respect the other's health and consent. And we want to recognize that there are multiple factors that can make having this conversation very difficult. So, for example, maybe a lack of knowledge or a lack of comfort with talking about these conversations in your regular life. Maybe, especially among women, there might be a discomfort with kind of taking the lead and bringing this topic up to our partner. But once again, this is something that shows respect for each other because we don't want our partners to contract any STIs, and we want to make sure that any sexual activities we do engage in is something willing and enthusiastic from both ends. So, if when negotiating safer sex, the partner does not like the idea of using protection, maybe they're not a fan of using condoms, there are still things that one can do moving on from that conversation. So, for instance, they can have further discussions on why they don't want to use protection and kind of just re-talk about the benefits of safe sex. They could also discuss practicing other methods of safe sex without the exchange of bodily fluids. And they could also establish boundaries for when sex would happen between the two. So, for example, one boundary could be only having sex when both parties are sober and able to give consent. And finally, if after negotiating safe sex, after having these conversations, you decide that you don't want to take the risk, or we just straight up don't want to have sex after that, that is okay. Everybody deserves protection from an unwanted infection or pregnancy. You are totally in the right to be able to say no, because at the end of the day, it's both parties being involved in sex.
Could not have said it better myself. So, we just wanted to present some different resources for STIs and safe sex generally. So, there's three different slides. So, we've got Georgetown, Berbice, and just also specifically HIV related resources. So, we'll just scroll through the three, and whichever place or one may be relevant, it would be great for you to take down that information.
Mm-hmm.
Yeah.
All right. Thank you guys for watching the video for this week, and we appreciate you guys learning a little bit more about sexual health.
Yeah, thank you.